State. This is Good Morning Ulster. A County Antrim GP has told BBC News NI that she's hugely concerned for women who need breast cancer treatment in Northern Ireland after 3 patients in her surgery received a late cancer diagnosis. The patients are among 32 women in the Notting Hill medical practice, which is based in Whiteabbey, who were red flagged within a 5-month period this year.
Well, Dr Gilly O'Hagan says that the new regional breast cancer system is not functioning, and women here, compared to the rest of the UK, are receiving a substandard service. She says for some women, the wait is affecting their prognosis. The Health Minister, Mike Nesbitt, says he appreciates the wait is adding to patients' anxiety, but that the new regional breast cancer treatment is beginning to show improvement. He says there's evidence that most are having to wait 7 weeks. The NHS target is set at 2 from referral to being actually seen by a consultant.
Let's speak to our health correspondent, Mary-Louise Connolly, has a story. Morning, Mary-Louise.
Morning, Chris.
I mean, this is obviously of huge concern to women, and you've spoken to some of those affected.
Yes, and they told me that while a cancer diagnosis is traumatic enough to deal with, a late cancer diagnosis can be life-changing, even life-limiting. And Chris, it's a similar story across Northern Ireland, as well as the women who attend the Notting Hill medical practice in the Northern Trust. I've also spoken to a woman in the Southern Trust who, after waiting almost 18 weeks from her GP referral to starting treatment, she's now dealing with a terminal diagnosis. And some of the women who spoke to me have started chemotherapy, others are waiting for a start date. Understandably, Chris, none of these women wanted to be interviewed, but those in the Notting Hill practice in Whiteabbey did give their permission to Dr Gilly O'Hagan to speak on their behalf. In a 5-month window this year, 32 women were red flagged from this one practice in Whiteabbey. Dr O'Hagan says the wait is causing patients further trauma.
We see a lot of women with breast lumps, and we've referred red flag 32 women from in the past 5 months. Out of those, 9 are still yet to be seen, so all the patients from October. The ones that have been seen, 3 of them have a positive breast cancer diagnosis, and all of them waited minimum 8 weeks to be seen, and 1 actually had to go privately. The waits are just horrendous, and I'm hugely concerned for our patients and how these delays are going to affect their outcomes. I mean, that used to be obtainable, but I was so shocked. I think that's why this has come about. I was so shocked. I referred my patient in June and she was seen in September, and I couldn't believe it. It's just horrendous. It's a failure of the pathway, and it's a complete breach of safety.
Chris, breast cancer waiting times have been increasing here for a decade. And to address what's being called a postcode lottery across the system, a regional system was introduced by the Health Minister in May, and that means there's meant to be one system operating in Northern Ireland to ensure that the most urgent cases are seen first, with women asked to attend appointments in perhaps a hospital outside of their area, even at short notice. A breast cancer consultant who works in the heart of the system told me that this new system isn't working, and there is still a breakdown in how women are being contacted and brought into the oncology service. That consultant also told me that the additional clinics that have been set up to try and tackle the problem are not really improving things. Things are continuing just to stay as they are. They also said that those delays are costing lives. And that view is supported by Dr O'Hagan, who, like so many, are seeing it all from the front line.
There's bottlenecking, so the breast cancer service has become Northern Ireland wide, and for their change, whatever has happened, they're just not meeting the targets. Whether it's lack of appointments, I don't know, but it's...
Well, is that regional service working?
No, it was never this bad before, so it's clearly not working now.
And we know, Mary-Louise, just how much work you've done to raise attention to the concerns about waiting times, but they've also caught the attention of the national charity Cancer Research UK. They are concerned about cancer waiting times in Northern Ireland. What are they saying?
They are, and they have contacted members of the Health Committee and contacted me, and they say that while waiting times in England, Scotland and Wales aren't perfect, Northern Ireland's waiting times are by far the worst across the UK. They've described our times as shocking, with people coming to potential harm. Naser Turabi told me that research shows that every additional 4-week wait for a patient reduces patient survival by an average of 10%.
We're worried about people who are waiting longer than 2 months to get their cancer treatment. And cancer is such an aggressive disease in some cases that it becomes harder to treat with time. So that has implications for patients on their survival when it comes down to it. For each 4-week delay in cancer surgery, for example, we estimate that's about a 6 to 8% increased risk of death.
Yeah, it's important to say, I mean, nowhere in the UK, I mean, England's cancer list, for example, aren't perfect, but they're not as bad. How are they tackling the problem there?
Well, Cancer Research UK says it's not always about the money, but how that money is being spent and how the service, Chris, is being managed. For instance, we know that once patients get into the oncology system, their care in Northern Ireland is often the very, very best. But the hurdle is getting into the system, getting through to the GP, being seen by the consultant, and then your pathway being organised by that consultant. So it's about the appointment process, it would seem. And according to the women who spoke to me, they say that's where the major block is. Naser Turabi from Cancer Research UK says patients must be seen and treated as individuals.
I would expect staff in hospitals to know each cancer patient by name so that they can treat that patient as an individual and really not accept the delays that have become commonplace in the system. So that means making sure they get the treatment absolutely on time without delay. Cancer
Research UK has delivered a briefing paper to Northern Ireland's Health Committee, and among its recommendations, the charity says that the Health Minister must commit to substantially improving overall cancer waiting times within 12 months and rapidly put in place a roadmap, governance and the necessary funding to achieve it.
Mary-Louise, thank you very much indeed. Now, when asked by BBC News NI what he would say to those women who have received a late cancer diagnosis, we got a statement from Mike Nesbitt in which he said, "I recognise that delays in access to breast assessment will heighten patient anxiety. I welcome the gradual improvement in waiting times in recent weeks, with women now waiting around 7 weeks to be seen. While this is still too long, I anticipate that this will continue to reduce." And the Minister said that proves that where additional capacity is available, the regional waiting list is capable of achieving its target.
Yeah, the Assembly were debating this last night and the Health Minister gave an update on the regional breast cancer service. This is what he said.
Last month, additional breast assessment clinics delivered 374 appointments. And this saw the waiting times on that regional list reduced from the high of 10 weeks, which was absolutely unacceptable, to a less unacceptable 7 weeks and 2 days. And that was on the 7th of November of this year. So we've gone quite rapidly from 10 weeks to 7 weeks, 2 days. As long as we continue that journey, then I will remain convinced that the regional list was the right thing to do.
Well, with us is Sinn Féin MLA Philip McGuigan, who's chair of Stormont's Health Committee, and the DUP's Diane Dodds, who also sits on the committee. Morning, both. Philip McGuigan, if I could start with you. You heard what the Health Minister had to say there. 10 weeks down to 7 weeks. He said the system is improving, but cold comfort for those women who have been waiting.
Absolutely. And can I start by saying I can only imagine the impact that any of this has happened on the individuals highlighted this morning and their families. The waiting lists for breast cancer referral are totally unacceptable. Targets continue to be missed. I mean, I could also identify the fact that women continue to be let down within our health service. I mean, yesterday we had our third debate on the topic of cancer and waiting lists and 6 months, and MLAs continue to shine a light on it and prioritise it and want to hold the Minister to task to improve it. But we continually see in debate after debate how women in particular are being let down. You know, this is following on from the cervical screening failures and other women's health issues. But the targets need to be met. I mean, what we're dealing with here are life-threatening illnesses, and Cancer Research have clearly identified and pointed out that any delay in meeting these targets and the impact that that's having, in some cases in terms of life expectancy. So this morning what we're talking about is no shock. I mentioned yesterday during the debate that in the 3 months prior to June of this year, almost 2,000 patients were seen by breast cancer specialists following urgent referral of suspected breast cancer. Only 129 of those patients were seen within 14 days of their urgent referral. So, I mean, the examples of Dr. Hagan's practice are unfortunately far too common across the north, and it is totally unacceptable. And the Minister and the Department absolutely need to get a grip and solve this problem.
Diane Dodds, does this regional service, the idea of which was to prioritise the most in need and to improve the system, does it need a chance to bed in with a bit of extra kind of push maybe along the appointments process, or should it just be scrapped?
Well, it's hard to chop and change services in this way. And I mean, we were told it would need some time to bed in, but it's been in place since May. And let's remember, Sarah, the service before that was extremely patchy in terms of how women were treated. So I led a debate like last night's debate, this time last year exactly, on the service then, and we would see the Western Trust where 90% of women would be seen within the target time, but actually in the Southeastern and Southern Trust that came down to under 10%. So it was a postcode lottery, but the new service does not seem to have actually been set up in a way that makes it efficient and makes women be seen much earlier. Can I say, it's really important to remember that we're talking about breast cancer now, but also in the quarter up to June 2025, 840 patients, 2/3 of all of the patients diagnosed with cancer waited longer than 62 days to start treatment. In England, that is 69%. In Scotland, that is 70%. Here, it is 33%. That across all of the tumour sites and all of the cancer issues is an appalling statistic. The other statistic when looking at this in sponsoring the debate last night, that is really, really important to remember, that 31.4% of stage 4 breast cancers are diagnosed when someone is in an emergency situation.
Yeah, in
and
the
that
ED.
is yes, and that is a very, very late diagnosis. But the story today is of women, and I outlined the story of a woman who at 41 took 15 weeks to be diagnosed and start treatment.
Yeah.
And in that time, her cancer had spread to her lungs.
Well, there's a diagnosis that Marie-Louise has been speaking to a patient about as well. We are time limited this morning, so I wanted to ask you briefly, if I may, about another story related to that debate last night, Diane Dodds, and perhaps get your reaction quickly, Philip McGuigan, as well. And that's about this money, £70 million that has been used to help tackle budget difficulties that was supposed to be spent on waiting lists. Now, the health minister says it wasn't ring-fenced completely for dealing with waiting lists, but nonetheless, 70 million out of an 80 million has gone to deal with the deficit, i.e. what we owe as a health budget. So what do you make of that?
I am actually... I described this last night in the chamber. This came to my attention about 10 days ago. And I took the opportunity last night to ask the Minister directly, was this accurate? Because I do think that this is a very serious breach with the people of Northern Ireland. We were promised, as he said, up to 215 million to tackle waiting lists. We know that 85 million has been spent on red flag cases, on diagnostics and things associated with that. We know that 40 million has gone to people who are waiting more than 4 years on the waiting list. And there have been some progress in relation to all of that, in relation to that. But the rest of that, I was told 73.5 million has actually now been taken away from that waiting list pot into the deficit pot. And I understand the imperative for a balanced budget, but I do genuinely believe that this is a poor way to achieve a balanced budget and is a breach of faith with people in Northern Ireland.
Thank you. I just need to bring Philip McGuigan in on that. What do you think of this? I mean, Mike Nesbitt's saying if he didn't do this, even having done this, there's a good chance that they won't balance the budget by the 31st of March next year. So do you see why he's done it, or do you see it as a breach?
I raised this issue when the Permanent Secretary was on the committee a number of weeks ago and had a discussion about the difference between money being ring-fenced and earmarked. But the obvious question is that the Health Minister asked the Executive for 215 million to deal with waiting lists, and the Executive have clearly prioritised health and allocated the 215 million. I think people out there in the public will be asking the question, if the Minister was given 215 million to deal with waiting lists, why we're on this morning having a discussion about waiting targets for cancer being well over what they should be.
Thank you both very much. Philip McGuigan, Sinn Féin MLA, and DUP's Diane Dodds also sitting on the Health Committee at Stormont.
It is 8:22.